Hi everyone, this is Mr. Neil Wright here, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched very shortly. If you are interested in the WAXscope, feel free to email info@clearwax.co.uk and we should add you to our mailing list. We have a patient who attended with really narrow ear canals and very soft, sticky, very difficult wax to suction. It's got that consistency where it's a bit wet and loose as well. And this is their left ear. I'm using our 4.25mm speculum to dilate and straighten out the outer third of the ear canal, so the cartilaginous portion. And just to the left, you can see a bit of the cartilage. That's the second bend. And this wax plug extends beyond the second bend. I've just instilled some olive oil medical grade spray, which changes the consistency. So I use the clear olive oil spray. It's just easy to use and it's available to purchase from our website. So if you visit www.clearwax.co.uk, and if you are a professional and wish to purchase in bulk, you can just register to our trade shop. So visit our website again, select sign in and then create an account, but please do select you're creating an account as a professional, otherwise you won't get access to the online trade shop. So you can see how well the olive oil works here. It just binds this plug together. If you've been watching my videos and following my channel, you know I like to make comparisons, food analogies, and I always compare the olive oil to an egg. For example, in a potato cake or fish cake recipe, it helps to bind all the ingredients together, and olive oil does the same with regards to wax. That's the patient's eardrum. You can see how crystal clear the view we've got there. You can see all the blood vessels. You can see also the opaqueness and calcification of the eardrum. We call that tympanosclerosis, when the eardrum becomes scarred. You can get scarred eardrums due to acoustic trauma, such as constant or prolonged exposure to noise over many, many years. Barotrauma, so sudden impression change, physical trauma, so a blow to the head or to the ears, and you can also suffer from surgical tympanosclerosis, so post-surgery as the eardrum heals, or post-infection. So the left ear is complete. This is the right ear. This is even more wet and loose and more sticky, more of a caramel consistency. So I think I put some olive oil spray immediately, just because you can just tell by the consistency of the wax. And also skin, it's a higher concentration of keratin here. And it's keratin that gives it the glossy appearance. So keratin is a protein that's also found on our fingernails and hair. And as it oxidizes, it can turn yellow in appearance. And keratin reflects light more so than earwax. And it can get a bit of a shiny appearance. That whiteness there that you just saw on screen, that wasn't the keratin. That was, the patient had a few hairs just outside her ears, and it was every time I tucked it behind her ears, they came back. So it was just the hairs getting in the way, so I just had to move them. I think it happens a couple of times. You can see there, it's just a wavy hair. And I think I will move that in a minute. Yep, as I was holding the WAXscope in the ear, just with the other hand, I just placed the hair over the ear. You can see it's a very tricky type of wax to suction. It just keeps blocking the tube, so I have to go in and out on several occasions here. So I've just put some more drops in there. The olive oil is a godsend. It really, really does help massively, and I'm using it more and more in clinic. I would say probably half of the procedures I perform, I would probably be using some olive oil medical grade spray, the Clear brand. So, similar to their left ear, the entrance is quite narrow, so the speculum helps to dilate the ear canal. That's where a lot of people struggle to use the WAXscope, our flagship product, the endoscope. In terms of optics, there's no comparison. The endoscope provides the ultimate view of inside the ear when removing earwax. However, if you struggle to use it, then it doesn't matter how good the view is. It's not going to be something suitable for you to use in clinic. So hence why we've also developed the WAXscope, and I would say the WAXscope is the second best alternative on the market. So if you're not able to use the WAXscope, then the WAXscope is the next best alternative. The problem at the moment, if people can't use an endoscope, they're using, in my opinion, suboptimal alternatives. Apart from an ENT microscope, that's something I can endorse. And the view that we're actually offering with the WAXscope is not too dissimilar to an operating microscope, albeit in 2D. With an ENT microscope, you look through both eyepieces, so you get binocular vision to a point. Now, if the wax is very deep, it may not be possible to achieve binaural binocular vision with an ENT microscope. And also, if the ear canal is very, very narrow, you still may not develop that. But similar to an ENT microscope, you've got great focus, you've got great magnification and clarity. So I'm just hovering over now. This is just some keratin that's on the canal wall. We've got to be careful. We don't want to graze that canal. But I was trying to peel that skin away because you can see there's a bit of remnant still deeper in the ear. The eardrum is visible in the distance, so they're hearing significantly better now. The sound can get through. And you'll see the eardrum in a moment. It's there in the background, but it's out of focus because we've adjusted the focus onto this wax and keratin. And it really is like caramel, this consistency. So we're just on the posterior canal wall here. We're probably 2/3 of the way into the ear. Quite a narrow ear, so we've got to be very careful. We've got to make very small micro movements with the sucker. If the movements with the sucker are exaggerated, then they will come in contact with the canal wall. And because we're so deep in the ear, the bony part of the ear is very, very sensitive. It'll be very uncomfortable for the patient. So I just want to see if I can remove a bit more. There's a bit deeper. So I've just adjusted the focus to get that in view because it's further in. We've just got to adjust the focus. And unfortunately, I managed to hover over it and remove this. There was a bit just lining the canal wall. I just left that because, again, don't want to make it uncomfortable for the patient. So I'm just suctioning some excess oil as well. That was in the ear. So again, I'm just adjusting the focus to see the canal closer to me more clearly. And I was just hovering over and I just decided at this stage to stop. More than happy with that. Bit of wax is good for you. In fact, I wrote, there's an article today published in the I newspaper, which is a national paper in the UK, where it featured myself and we're talking about the health benefits of earwax. I will put the link in the description. I hope you enjoyed that, and if you are interested, please do email info@clearwax.co.uk.